You woke up, went to the kitchen, opened the curtain, and the sunlight hit your eyes with a force that hadn't hit you before. You blinked, rubbed your face, thought it was a remnant of sleep, but the discomfort did not go away. Then you sat on the edge of the bed, took out your phone to check the time, and the lyrics danced a little before they settled. You thought, it's age. It happens. It's part of it. But it doesn't. And I'll explain to you what no one explained in the 15-minute consultations. At 50, 60, 70 years old, we carry a silent belief that seeing worse is normal. That tired eyes are just a matter of changing the prescription of glasses. What eye drops it solves. That one day we will operate on cataracts, and that's it. But what's going on inside your eyes right now as you listen to me is much bigger than that. It is a process that begins decades before any symptoms appear, and that has nothing to do with the fatigue of age. It has to do with a mechanism that almost no one explains. The retina, that very thin membrane at the back of the eye, consumes more oxygen per square millimeter than any other tissue in the human body, even more than the brain. Every cell in your retina is immersed in a chemical soup of light, oxygen, and free radicals at all times. And when this soup goes awry, the vision blurs, the colors lose their strength, the contrasts disappear. But you don't feel anything. It doesn't hurt. It does not burn. It just disappears. And then one day you don't recognize your grandson's face from 3 meters away. One day you mistake the medicine bottle. One day you stop driving at night because the headlights of the cars turn into bursts of light. And you accept. Accept it because everyone around says that's the way it is. He accepts because the doctor, in a hurry, said that it is natural degeneration. But it is not natural. What happens is that conventional medicine treats the eye as if it were an isolated camera. Change the lens, lubricate the surface, measure the pressure. But no one tells you that the eye is a direct extension of the brain. Yes, the retina is brain tissue that grew out of the skull during the baby's formation in the mother's belly. What attacks the brain attacks the eye. What inflames the brain inflames the eye. And what protects one protects the other. This information changes everything. It changes because it means that everything you eat, every hour of sleep you lose, every spike in blood sugar is messing with your vision in a much deeper way than you imagined. I want you to stop for a moment and think about the dimension of this. It's not about seeing the fine print on the leaflet. It's about continuing to be you. It's about looking at your child and seeing the expression on his face. It's about reading a book without a magnifying glass. It's about crossing the street safely. It's about not depending on anyone to choose the clothes, to hit the stove, to recognize the bus at the stop. Vision is autonomy, and what's stealing your vision isn't age. It is a set of processes that can be slowed down, and in many cases partially reversed if you understand what is actually happening. And that's exactly what I'm going to do here. I'm going to give you 7 signs that your eyes are giving right now. Maybe today, maybe this week, and that you're ignoring because no one taught you to read those signs. These are not obvious signs like pain or redness. These are subtle things which happen on a daily basis and that most people attribute to fatigue, time, luminosity. But behind each of them, there is a clear physiological mechanism. And behind each mechanism, there is a way of acting. In the end, you will understand why that eye exam you do every year does not show what really matters, and you'll know exactly what to ask at your next appointment. The first sign is the delay in adapting when you enter a dark environment. You turn off the light in the room, and for a few seconds, maybe even minutes, it seems that everything disappears. You are feeling the wall, looking for the switch on the lamp, feeling the floor with your foot. This is not just a lack of light. This is a delay in the regeneration of a substance called visual purple, which is inside the rods of the retina. Rods are the cells that see in the dark. They rely on a form of vitamin A that needs to be recycled all the time. When this recycling is slow, it takes you a long time to see in the dark. And what hinders this recycling is oxidative stress, which is the accumulation of free radicals inside the eye. Free radicals are unstable molecules that damage cell membranes. And where do these radicals come from? They come from excess blood sugar, chronic inflammation, exposure to unprotected blue light, lack of antioxidants in the diet. So that little time it takes you to see the switch is not just a nuisance. It is a biological marker. It's your screaming eye that the defense system is falling behind. Here I want to tell you the story of a patient. Let's call her Dona Celia, 68 years old. She arrived at the office saying that everything was fine, that her vision was great for her age, that she just wanted to renew the prescription for her glasses. But her daughter insisted that she come because Dona Celia had fallen twice in the hallway of the house during the night. She got up to go to the bathroom and tripped over the furniture, the shoe, whatever was in the way. I thought it was a lack of attention. But it was the delay in seeing in the dark. Her rods were slow. And this did not appear in the common eye exam, because the exam is done with strong light, with the pupil dilated, and basically measures central sharpness. But night vision depends on cells that are outside the center, on the periphery of the retina, precisely where the silent degeneration begins. Dona Celia was not falling due to inattention. She was falling because her eye wasn't able to adapt fast enough. And the fall, my friends, is what changes the life of a person over 60 years old. A femur fracture, a broken pelvis, and autonomy goes away in weeks. It all starts with a sign that seems small. The second sign is discomfort with the light. You go out on the street on a sunny day and you need to close your eyes. The light seems to pierce the head. You lower the car's visor, put on sunglasses, but it's still uncomfortable. A lot of people call it photophobia, but the word doesn't matter now. What matters is the mechanism. Inside the eye is a layer of cells that forms a barrier between the blood vessels and the retina. This barrier is like a very fine sieve. When it is intact, it lets through only what the retina needs and blocks what is bad. When it begins to rupture, inflammatory substances enter where they shouldn't. And one of the consequences is that the nerves in the retina become hypersensitive to light. It's as if the eye has sunburned skin all the time. Each ray of light is disturbing because the inflammation lowered the tolerance threshold of the photoreceptors. And what breaks this barrier? High blood pressure, silent diabetes, intestinal inflammation, lack of omega-3. Everything that circulates in the blood and shouldn't be there. The eye is the mirror of what is happening in the vessels of the entire body. When you look deep into someone's eye, you're seeing the health of the vessels in the brain, the kidneys, the heart. The brightness that bothers is not freshness. It is a sign that the barrier is asking for help. Pay attention to this detail. Many people buy stronger sunglasses, those that block almost all light, and think they have solved them. But the mistake is precisely there. Wearing excessively dark glasses indoors or on cloudy days sends a signal to the brain that it's always dark. And the brain then dilates the pupil even more when you take off your glasses, letting in even more light and causing more damage. It is the error that nullifies the benefit. What protects is not blocking all light, but rather modulating light, using lenses that selectively filter out the most aggressive wavelengths, such as blue and violet light, and at the same time training the eye to tolerate natural light progressively. This is done with a combination of internal strategies which involve specific feeding and supplementation, and external strategies which involve the right type of protection. Relief is not in running away from the light. It is in strengthening the eye to deal with it. The third sign is the feeling that the colors are more muted. You look out over the garden and the flowers don't look as vibrant as they once did. That blue sky is half washed out. The green of the leaves is kind of grayish. You think it's dirt on your glasses, you clean your lenses, but you're still the same. This is one of the most insidious signs because it comes on so slowly that the person gets used to it. But behind it, something very serious is happening. The macula, which is the central region of the retina responsible for seeing details and colors, is accumulating a toxic pigment called lipofuscin. Lipofuscin is like a cell rust. It is deposited in the cells of the retina and blocks the entry of nutrients. It's as if the car's windshield was becoming opaque inside. But this windshield cannot be changed. Lipofuscin builds up because the retina's cleaning system, which works primarily during sleep, is failing. The retina has a daily cycle. During the day, the photoreceptors burn fuel and generate waste. During the night, a layer of cells called the retinal pigment epithelium acts like an aspirator, phagocytizing this waste and sending it into the blood. If the blood is full of oxidized fat and sugar, this vacuum cleaner clogs. The lipofuscin stays there, layer upon layer, and the colors die away. But this does not appear in the routine exam until the damage is advanced. The exam measures how many letters you see in the table. It does not measure the saturation of the colors. And the person leaves the office with the new prescription and the false feeling that everything is fine. Now I want you to remember something. Have you ever been to a paint store? Have you seen how there are dozens of shades of white? Ice white, snow white, straw white. A person with a clear retina distinguishes these nuances. A person with lipofuscin accumulation sees everything half beige, half gray. And he doesn't even know he lost, because the loss is so gradual that the brain compensates, fills in the gaps with memory. You think the sky is blue because you know it's always been blue, but the blue you're seeing now may be just a shadow of what it once was. This is not poetry. It's physiology. And the good news is that the retina has an amazing regeneration capacity as long as you give it the right tools. Lipofuscin may be removed, the cleaning cycle can be reactivated, but that requires more than eating carrots. In fact, carrots are the greatest example of the common mistake that nullifies the benefit. People swear that carrots are good for the eyes because their grandmother used to say so. Carrots have beta-carotene, which is a precursor to vitamin A. But the beta-carotene in raw carrots has a conversion rate into active vitamin A that is very low, around 3 to 5%. And to make matters worse, the vitamin A that the retina uses for night vision and macula health doesn't just come from beta-carotene. It also comes from animal sources, in a form that is ready to use. And most people over the age of 50 have a harder time converting beta-carotene into active vitamin A because of changes in the thyroid and liver. So the person eats carrots thinking they are protecting their vision and are not even tickling the problem. This is the kind of betrayal of popular wisdom that I see every day in the office. Whoever is watching now, I want to make you a wish. If you are identifying with at least one of these signs, if you have noticed this delay in seeing in the dark, this sensitivity to light, or this loss of color vibrancy, write your city below. Just the name of the city where you are now. I read every comment, and it helps me know where that message is coming from. And if you can, leave your like and subscribe, because this type of content, which goes deep into physiology without fear, is the one that appears the least to people. And it is precisely the people who need it most who end up not receiving it. Share it with someone you love, not as someone who sends any video, but as someone who says, "Look, this spoke to me, see if it speaks to you too." The fourth sign is one of the most misleading. You're reading a book, a magazine, your cell phone screen, and suddenly you notice that some letters disappear in the middle of the word. You look straight at the word, and the center of it is half off, half crooked. Then you blink, move your head, and the letter comes back. This lasts seconds, sometimes minutes, and disappears. Most people call it eye strain and ignore it, but the technical name for this is transient metamorphopsia. It is a distortion in the macula caused by an accumulation of fluid between the layers of the retina. This liquid comes from small vessels that are leaking because the barrier I talked about before is compromised. When you blink, the tear film redistributes and the image improves, but the cause is not on the surface of the eye. It's deep inside, in the innermost layers of the retina. And with each episode of these, macula cells die, one by one, and the cells of the macula do not regenerate like those of the skin. They are nerve cells, like those in the brain. When they die, the empty space is filled with scar tissue, and scar tissue does not see. The person only notices it when the hole is already large enough to erase an entire face. Then the exam shows macular degeneration already installed, and the doctor says, "It's age," but it's not the age. It is the accumulation of micro-injuries that could have been avoided. I remember a patient, Mr. Armando, 72 years old. He arrived with his wife and said he was drawing some crooked lines on the wall of the house. He saw the frame of the picture straight, but the wall seemed undulating. His wife laughed, saying that he needed new glasses. But Mr. Armando was a detail-oriented man. He had been a watchmaker all his life. He noticed the ripple before it became a fixed stain. We did the appropriate tests, those that go beyond the Snellen table, and we found fluid under the macula. We intervened in time. We correct the diet. We enter with specific nutrients. We modulate inflammation. 6 months later, the swell had disappeared and his vision was stable. If he had waited another year, perhaps the story would have been different. The big problem is that most people don't have the fine perception of a watchmaker. Most wait for the dark spot to appear, and then it's too late, because the central dark spot doesn't disappear. What disappears is independence. Here's what almost no one explains. There is a region in your eye that is the richest in two protective pigments. These pigments are called lutein and zeaxanthin. They form a yellow layer right in the center of the macula, as if it were an internal sunscreen. This layer absorbs high-energy blue light before it reaches the photoreceptors and causes oxidative damage. The thicker this layer is, the more protected its macula is. The thickness of this macular pigment is measured by an exam that almost no one does, because it is not covered by health insurance plans for screening. But it is the best predictor of macular degeneration that exists. And the thickness of this pigment depends on two things: what you eat and what you absorb. Because there's no point in ingesting lutein and zeaxanthin if your intestine isn't absorbing it. And do you know what hinders the absorption of these pigments? Guess what? Excess oxidized fat in the diet. Heated vegetable oils, fried foods, margarine, ultra-processed foods. These fats compete with lutein for entry into the cells of the intestine. So the person takes a very expensive lutein supplement but eats fried pastry and reused oil. And lutein comes out whole in the feces. It is the error that cancels. Again. Now I want to expand this idea to something even more fundamental. What really commands the thickness of macular pigment is not just the intake of these two nutrients. It is the presence of a third element, a biochemical partner that almost no one mentions. That partner is melatonin. Yes, melatonin, known as the sleep hormone. What few people know is that melatonin is not only produced in the pineal gland, in the brain. The retina also manufactures its own melatonin, locally, during the night. And this melatonin has a double function. It acts as an extremely potent antioxidant, scavenging free radicals directly, while at the same time stimulating the cells of the pigment epithelium to phagocytize waste, including lipofuscin. That is, melatonin activates the retinal aspirator. But melatonin production in the retina depends on a very specific stimulus: complete darkness, without any artificial light. If you sleep with the television on, with the lamp on, with the hallway light coming in through the crack in the door, the retina understands that it is not yet deep night. It reduces melatonin production, and the cleaning doesn't happen as it should. Every night you have slept, every night with undue light, is a night when your retina has accumulated garbage that has not been swept away. Over time, this garbage becomes lipofuscin, and lipofuscin becomes the spot. This is an important body immersion. Imagine the pigment epithelium of the retina as thousands of small workers who only work in absolute darkness. If you turn on a flashlight in the middle of their turn, they stop. And the factory is clogging with waste. This is the kind of detail that transforms the way you sleep starting today. Because it's not just about resting, it is about seeing tomorrow. Another patient, Mr. Clovis, a retired bus driver, 74 years old. He had slept with the TV on at low volume since he was widowed because the silence hurt, and his vision was getting worse in a way that his glasses couldn't follow. In the exams, the macula still had no hole, but the protective pigment was thin, almost transparent. When he agreed to turn off the TV, wear a well-fitting sleep mask, and take an extended-release melatonin supplement under guidance, macular pigment density began to improve within 6 months. It's not a miracle. It is giving the body the condition it needs to do what it already knows how to do. Mr. Clovis told me a phrase that I carry with me. "Doctor, I thought television kept me company, but it was television that was stealing my sight." That changed the way I explain sleep to all patients. The fifth sign is the feeling of sand in the eyes when you wake up. You open your eyes in the morning and it looks like there's a little grain in there. He goes to the mirror. He sees nothing. It washes your face, it improves a little, but the feeling comes back throughout the day, especially when you are in the air conditioning or in front of the television. The person goes to the pharmacy and buys lubricating eye drops, and relief comes at the time. But the relief lasts an hour, 2, and the feeling returns. Then the person uses the eye drops again, and again, and again, until one day the eye no longer produces any tears on its own. Do you know why? Because most over-the-counter lubricating eye drops contain preservatives that, with frequent use, intoxicate the goblet cells of the conjunctiva. These cells are the factories of the innermost layer of the tear film, the mucin layer, which makes the tear stick to the eye instead of flowing. When these cells die intoxicated by the preservative, the artificial tear no longer sticks. The eye is dry inside even though it drips eye drops all the time. It is the betrayal of the system. The industry sells the immediate relief and causes the long-term damage, and the doctor, in the 15-minute consultation, does not have time to explain this. He prescribes the eye drops that the representative left as a sample, and that's it. But the root of dry eye is not only on the surface, it is in the inflammation of the glands that produce tear fat, the meibomian glands, which are on the edge of the eyelids. These glands clog. The fat they produce becomes mushy, like butter in the fridge, rather than flowy like olive oil. And without that fat, the water in the tear evaporates in seconds. The eye becomes dry. The person blinks more. The friction of the eyelid inflames the cornea, and the cycle worsens. Now think about the dimension of this. Dry eye is not just discomfort. It is a gateway to infection. It is the cause of blurry vision that fluctuates throughout the day. It is a risk factor for corneal ulcers, and the solution is not in the eye drops. It is in what fluidifies the fat of these glands, omega-3. But not just any omega-3. It has to be omega-3 in the form of triglycerides, with a high concentration of EPA and DHA, and it has to be used for at least 3 months to replenish the membranes of the glands. But most people buy omega-3s from the supermarket shelf, in the form of ethyl ester, with very low absorption. And it stops after a month because it hasn't seen any results. Error that cancels. Again, impatience and poor quality of the supplement sabotages the treatment, and the person goes back to the eye drops with preservative, and the damage continues. But the hole is even lower. Meibomian glands don't clog just for lack of omega-3. They clog because the person blinks wrong. Yes, blink wrong. With the use of screens, cell phones, computers, television, we tend to blink incompletely. The eyelid does not touch the lower eyelid, and this incomplete movement does not milk the glands. The meibomian glands rely on the mechanical act of full blinking to squeeze fat out. If the eyelid does not close entirely, the fat stays inside, standing still, oxidizing, hardening. It's like a tube of ointment that you never squeeze all the way through. The ointment dries on the tip and clogs. Donna Marley, 61 years old, spent hours on the tablet playing solitaire. The eye burned too much. She dripped eye drops 5, 6 times a day. When I explained that she needed to relearn how to blink, she laughed. He thought it was a joke, but it wasn't. We created a simple exercise. With each cell phone notification, she made 5 complete and long blinks, squeezing her eyelids well. After 3 weeks, the use of eye drops dropped by half. After 2 months, she only dripped once, when she went to bed. Her tears spread the fat again. The eye stopped burning. The chronic dry eye that she treated as inevitable was solved with a gesture she had made since she was a baby, only now intentionally. That's the power of the right information. It is not expensive medicine. It is to understand how the body works. The 6th sign is the sight of floaters. Those little dots, threads, cobwebs that float in front of the vision, especially when you look at a white wall or the clear sky. Almost everyone has it, and most of them heard the phrase, "It's normal, there's nothing to do, get used to it." But floaters are not normal. They are aggregates of collagen fibers that have been released inside the vitreous humor, which is the gel that fills the eyeball. Over the years, the vitreous liquefies. It shrinks and detaches from the retina. In 90% of cases, this abruption is benign. But in the remaining 10%, it can pull the retina and cause a tear. And a retinal tear can develop into a retinal detachment in hours, and retinal detachment is an emergency that can lead to irreversible blindness within days. So when someone tells you to ignore floaters, they're ignoring the risk. What you need to watch for is change. If floaters suddenly increased, if they were accompanied by flashes of light in peripheral vision, as if it were lightning or the flash of a camera, this is a sign that the vitreous is pulling on the retina. This requires a dilated pupil fundus examination within 24 hours. It's not next week. It's not when you can. It's on the same day. Because if there is a tear, it can be sealed with a laser in minutes in the office, without cutting, without hospitalization. But if it takes off, it's surgery. And retinal surgery is one of the most delicate that exists. The recovery is long, the head-down position is strenuous, and the visual result is never the same. But here's the revelation that almost no one makes. What accelerates vitreous liquefaction and posterior detachment? Glycation. Glycation is the process in which sugar molecules stick to proteins in the body, such as collagen, and harden them. Glycated collagen breaks down easier. Vitreous is pure collagen. The more blood sugar spikes, the more glycation, the more fragile the vitreous. The sooner it detaches, the greater the risk of tearing. And glycation doesn't just come from white sugar. It comes from French bread, white rice, pasta, cream cracker cookies that seem harmless. These foods turn into blood sugar within minutes. And if the person has insulin resistance, which is common after the age of 50, the sugar spike is high for hours. Hours of glycation, hours of collagen being bombarded, and the person doesn't feel anything until the day he feels the flash. And then it's already an emergency. So the sixth sign is not the floater itself. It's her sudden increase. It's the flash. It's the feeling of a dark curtain falling in the side view. This is never normal. And if someone says it is, be suspicious. Look for a retina specialist on the same day. I want you to understand one thing. Your eye is not a passive camera that only registers what is in front. Your eye is a metabolically active organ which consumes energy, which produces waste, which ignites, which repairs itself, which responds to everything you do. Each bite of food is a chemical piece of information that arrives in your retina in a matter of minutes. Every night of poor sleep is a night when the retinal cleansing system didn't work. Each episode of anger, of prolonged stress, is a bath of cortisol that constricts the vessels and reduces the flow of blood to the optic nerve. The optic nerve is the cable that connects the eye to the brain. It has 1 million nerve fibers, and glaucoma, which is the second leading cause of blindness in the world, is basically the progressive death of these fibers. What else is known about glaucoma? That elevated intraocular pressure is the main risk factor. But what few people tell you is that there is normal pressure glaucoma. People who have eye pressure within the range considered safe and still lose optic nerve fibers. Why? Because the problem is not just the pressure. It is perfusion. It is the amount of blood and oxygen that reaches the nerve. And this perfusion drops when the person has sleep apnea, for example. Sleep apnea is the arrest of breathing during sleep. It happens a lot to those who snore. At each stop, the oxygen in the blood plummets. The optic nerve, which is already very sensitive to the lack of oxygen, suffers silent microinfarctions. The person wakes up tired, with a headache, and does not know that during the night his optic nerve was starved. She does the eye exam, the pressure is normal, and she leaves calmly. Years later, he starts to bump into things because his peripheral vision is closing. Glaucoma has already taken half of the fiber. And half of the fibers don't come back. Glaucoma is a silent thief. It does not blur the center of vision. He steals the edges, and the person only notices when the visual field is already very reduced, when he can no longer drive, when he stumbles on steps that he does not see. Now, pay attention to this detail. There is a substance that has been studied for more than 20 years and that has an impressive protective effect on the optic nerve. It is called citicoline. Citicoline is a compound that the body produces naturally, but with age it decreases. It is a precursor to phosphatidylcholine, which is an essential component of the nerve cell membrane. When you supplement citicoline, you are providing raw material for the optic nerve to repair its membranes. Serious clinical studies, published in high-impact ophthalmology journals, have shown that oral citicoline, in adequate doses, is able to stop the progression of glaucoma. In some cases, there was even an improvement in the visual field, something that was considered impossible until recently. Citicoline works by improving nerve impulse conduction, reducing cell death, and increasing dopamine production in the retina. Dopamine in the retina regulates the renewal cycle of photoreceptors and protects against toxic light. The problem is that citicoline is not an over-the-counter drug anywhere, but it exists. It is studied. And most glaucoma patients have never heard of it because the standard conduct is only eye drops to lower blood pressure. But lowering the pressure is treating the risk factor, not the cause of cell death. Neuroprotection is the future, and it's available now. This is the kind of information that changes prognoses. I see a lot of people who did everything right and didn't improve. People who have exchanged sugar for sweetener, who have stopped eating fried foods, who go to the ophthalmologist every year, who take their eye drops religiously, and even so, his vision worsens. And this person feels betrayed by his own body. He feels angry. He feels afraid, fear of becoming a burden, fear of not recognizing the grandchildren, fear of falling on the street and not being able to get up, fear of losing reading, which is the last company of those who live alone. This fear is legitimate, and it is drowned out by phrases like, "It's part of the age," or "There's no way around it." But there is a way. But the way is not in the 15-minute office. The way is to understand that the eye is part of an entire body, that the inflammation of the eye is the same as the inflammation of the intestine, that the oxidative stress of the retina is the same as that of the brain, that the glycation that stiffens the vitreous is the same that stiffens the arteries. Everything is connected, and when you treat the body as an integrated system, the eyes respond. Now I'm going to reveal something that will sound strange at first, but which is backed up by a huge amount of evidence. The gut and the eyes are connected in a way that medicine is only now beginning to understand in depth. There is what we call the gut-retina axis. What happens in your gut directly affects your retina. The bacteria that live in your colon produce substances that fall into the bloodstream and end up inside the eye. When good bacteria predominate, they produce short-chain fatty acids that are powerful anti-inflammatories. They cross the intestinal barrier, enter the blood, reach the retina, and literally erase foci of inflammation. When bad bacteria predominate, they produce lipopolysaccharides, which are toxins that inflame everything they pass through, including the retina. A person with leaky gut, a condition in which the gut barrier becomes loose and lets toxins pass into the blood, has a much higher risk of macular degeneration, uveitis, severe dry eye. And what causes leaky gut? Diet low in fiber, rich in ultra-processed foods, chronic use of non-steroidal anti-inflammatory drugs, use of proton pump inhibitors for gastritis, chronic stress, thyroid changes. All of this undermines the integrity of the intestinal barrier, and the eye pays the price. So when a person comes in with dry eye that doesn't get better with anything, and you investigate and find out that they have reflux and have been taking omeprazole for 10 years, you've found the root. Omeprazole reduces stomach acid, but stomach acid is a barrier against bacteria. Without it, bad bacteria migrate to the small intestine, cause bacterial overgrowth, inflame the mucosa, open intestinal permeability, and the inflammation ends up in the eye. It's a waterfall. And the solution is no longer an eye drop. It is to correct intestinal dysbiosis. This takes time. It requires a change in diet. It requires glutamine supplementation to regenerate the barrier. It requires specific probiotics. But the eye answers. Because the eye is the mirror of the intestine, that phrase can save your eyesight. Dona Fatima, 59 years old, had such a severe dry eye that she could no longer read at night. His eyes burned as if he had pepper. She had already spent a fortune on imported eye drops. Nothing solved. At the appointment, she mentioned in passing that she had constant heartburn and that the general practitioner had prescribed continuous omeprazole. I went to investigate. Stool examination showed severe dysbiosis, toxin-producing bacteria dominating the intestinal environment. We entered with an intestinal restoration protocol, cutting ultra-processed foods, introducing soluble fibers, glutamine, specific probiotics, and, under supervision, gradual withdrawal of omeprazole. In 4 months, her tear has quality again. The eye stopped burning. She went back to reading, and the heartburn disappeared. Her eye wasn't the problem. It was the sentry who warned that the intestine was on fire. This story repeats itself more than we imagine. And speaking of the intestine, there is a food that is sold as healthy and that is sabotaging the vision of millions of people. It is canola oil, soybean oil, corn oil, sunflower oil. These refined vegetable oils, which are in virtually all processed foods, are rich in omega-6. Omega-6 is an essential fatty acid. That is, the body needs it, but in the right amount. The problem is that the modern diet has a ratio of omega-6 to omega-3 that is as high as 20:1. The ideal would be something around 4:1 or even 2:1. This imbalance inflames the entire body, including the retina. Excess omega-6 competes with omega-3 for the same converting enzyme, delta-6 desaturase. This enzyme transforms the short-chain omega-3s, which come from plants, into EPA and DHA, which are the active forms that the eye uses. If the enzyme is busy processing excess omega-6, it does not process omega-3. Result: functional deficiency of DHA in the retina. DHA is a structural component of photoreceptors. Without enough DHA, the membranes of the photoreceptors become rigid and brittle. Cell renewal slows down. Communication between cells fails, and his vision worsens. The person thinks he is eating well because he stopped frying in lard and started using sunflower oil. But she exchanged one problem for another. Lard, used sparingly, is thermostable and does not oxidize at high temperatures. Sunflower oil oxidizes and generates toxic aldehydes, which are absorbed and go straight to cell membranes. It's another mistake that cancels out. The industry sold the idea that vegetable oil is healthy, but what matters is not whether it is plant or animal. It is the thermal stability, the degree of processing, and the ratio of omega-6 and omega-3. That changes everything. We have reached the seventh sign. This is the most subtle, and perhaps most importantly. You're talking to someone, looking at the person's face, and you have the feeling that you're seeing, but you're not seeing. It is as if the image arrives, but the meaning takes time to be processed. You hear the voice, you see the mouth move, but the facial expression seems half-faded, half-distant. This is not a vision problem in the traditional sense. It's a visual processing problem in the brain. The image is clear on the retina, but the visual cortex, which is at the back of the head, is taking time to interpret. This is linked to a reduction in the speed of transmission of electrical impulses through the optic nerve. The myelin sheath, which is the insulating layer of nerves, thins with age and with the lack of specific nutrients such as vitamin B12, good cholesterol, and DHA. Myelin is made of cholesterol. Yes, the cholesterol that has been demonized for decades. The brain and optic nerve need cholesterol to maintain myelin. People who take statins to lower cholesterol can, in some cases, have a side effect of worsening cognitive and visual function, because the statin does not choose where it will act. It inhibits the production of cholesterol throughout the body, including in the brain, and if the myelin doesn't have enough cholesterol, the conduction of the nerve impulse slows down. The person sees but does not process. This is a huge loss for quality of life, because life happens in fractions of a second. Recognize a face, dodge an obstacle, read a traffic sign. If processing is slow, autonomy is at risk. And no one tells you that. No one tells you that the health of your eyes and the health of your brain are the same thing. That protecting vision is protecting cognition. That what is good for the macula is good for the hippocampus. Observe this carefully. There is an exam that measures the speed of visual processing. It is not a common eye exam. It is most commonly used in research and neurology, but he reveals impressive things. People with DHA deficiency, with low levels of lutein and zeaxanthin in the retina, have a significantly slower processing speed, and when these nutrients are replenished, the speed improves. It improves not only vision, it improves attention, short-term memory, reaction time. Because the eye is the gateway to the brain. If the input is slow, the entire system slows down. Now, think about the implication of that. A person with slow visual processing is more at risk of falling, more risk of having a traffic accident, more risk of social isolation because they feel insecure. Social isolation is one of the biggest accelerators of cognitive decline, so one thing leads to another. Poor vision leads to isolation. Isolation leads to depression. Depression inflames the body. Inflammation worsens vision. It's a vicious cycle. And the exit door of this cycle is nutrition, correct supplementation, quality sleep, blood glucose control, intestinal health. And here I'm going to open a curiosity gap before closing. Often the person realizes that they have a processing problem, but attributes it to the aging of the brain. What she doesn't know is that there is a nutrient that acts directly on the speed of the nerve impulse. This nutrient is not the citicoline I have already mentioned, although citicoline also helps. It's another. A compound that is present in very specific foods and that, when lacking, the brain literally slows down. This compound is phosphatidylserine. Phosphatidylserine is a fat that makes up the membrane of nerve cells and maintains the fluidity necessary for electrical signals to jump from one nodule to another. With age, phosphatidylserine production drops. Supplemental replacement in clinical studies has shown improvement in processing speed, memory, and perceived visual clarity. But there is a common mistake. Most people take soy-derived phosphatidylserine, and soy for many people is inflammatory, especially if there is intestinal sensitivity. Phosphatidylserine of marine origin extracted from cold water fish, is more bioavailable and does not carry the inflammatory potential of soybeans. But it's more expensive and harder to find. So the person buys the cheap soy supplement and feels no effect. Then let go. Error that cancels. Again. The quality of the raw material makes all the difference when it comes to nerve membrane. Now I want to connect this with another organ that no one relates to vision. The liver. The liver is the great conductor of the metabolism of fats and fat-soluble vitamins. Vitamin A, vitamin E, vitamin D, vitamin K all depend on the liver to be processed and distributed. The liver also produces bile, which emulsifies fats in the intestine. Without enough bile, you don't absorb lutein, zeaxanthin, omega-3, vitamin E. You can eat everything right, but it doesn't go up into the blood. And what overloads the liver and thickens the bile? Diet rich in refined carbohydrates and fructose, alcohol consumption, excessive use of medications such as paracetamol, and also the famous detox juice that the person drinks thinking they are rocking. Fatty liver, a condition that affects more than half of the population over 50 years of age, often does not give any symptoms, just a metabolic slowdown, and one of the first places to feel this slowness is the retina, which needs a steady stream of high-quality, fat-soluble nutrients. Mr. Juon, a 66-year-old man, had his eyesight getting worse every year. He did everything I recommended. He ate fish, took omega-3, ate free-range eggs. But the vision continued to drop. When we examine the liver, we find moderate hepatic steatosis. The liver was so busy dealing with the excess of bread and beer that it couldn't export the nutrients. We corrected the diet, removed the alcohol, entered with silymarin and choline to unlock the liver. Within 3 months, his absorption had improved so much that his vision had stabilized and his sensitivity to light had decreased. The problem was never the eye. The eye was the victim. The liver was the silent villain. Pay attention to this detail. There is a simple and inexpensive test that can indicate if your liver is hindering your vision. It is the dosage of the GGT enzyme in the blood. Elevated GGT suggests liver stress and thick bile. Few people ask for this exam in their routine, but it is a window into why nutrients are not reaching the eye. This is one of the memory anchors you can take to your next appointment. Ask to dose GGT. If it's high, investigate the liver, because liver health and macula health go hand in hand. Returning to the eye itself, I want to detail a phenomenon that occurs in aging and that almost no one discusses: retinal calcification. Over the years, calcium crystals may be deposited in the layers of the retina, especially in Bruch's membrane, which is just below the pigment epithelium. These crystals work like small mirrors that scatter light. They also make it difficult for nutrients to pass through. This contributes to the formation of drusen, which are accumulations of oxidized proteins and lipids. Drusen are the classic marker of dry macular degeneration. And what accelerates calcification? Calcium-magnesium imbalance, vitamin K2 deficiency, excess vitamin D without the K2 counterpart, and chronic inflammation. Vitamin K2 is the key that directs calcium to the bones and teeth, taking it out of the arteries and soft tissues, such as the retina. People who take calcium supplements without K2 may be inadvertently calcifying the retina. This is another mistake that cancels out. Postmenopausal calcium supplementation, often recommended without K2, may be doing more harm than good for your vision. Instead of swallowing calcium carbonate, it is safer to get calcium from K2-rich food sources such as cured cheeses, egg yolks from free-range chickens, natto, and of course magnesium, which is the mineral that keeps calcium soluble in the blood, preventing it from precipitating. Magnesium and K2 together are vascular and retinal protectors. Now, an important body immersion. Imagine the inside of your retina as a city with water channels. The nutrients arrive through a fine current, which is the blood flow of the choroid. The waste is taken away by a drainage system. If the channels begin to clog with oxidized fat deposits and calcium crystals, the oxygen and glucose supply becomes irregular. The nerve cells of the retina begin to starve in the midst of abundance. This silent hunger generates the signs I have described: slow adaptation to the dark, loss of colors, sensitivity to light, floaters. What I'm handing you here is a map. Each signal is a sign that indicates which part of the system is broken, and most ophthalmologists don't have time, in the 15-minute consultation, to look at the entire map. They look at the pressure, they look at the degree, they look at the lens. And what's behind is still there, moving forward. Whoever is following me here, pay attention, because I'm going to give you another revelation. There is a phenomenon called collateral circulation in the eye. When small vessels in the retina occlude, the body tries to create new vessels to irrigate the area. That sounds good, but it's not. These new vessels are fragile, disorganized, and leak. It is called neovascularization. It occurs in diabetic retinopathy and wet macular degeneration. And what stimulates this disordered neovascularization is a substance called vascular endothelial growth factor, known by the acronym VEGF. The body produces VEGF when it feels a lack of oxygen. The more obstruction, the more VEGF, and more fragile vessels. Current medicine treats this by injecting anti-VEGF drugs into the eye, month after month. This saves the sight of thousands of people. But what no one explains to you is that you can, with food, reduce the production of VEGF from the inside out. Foods rich in polyphenols, such as purple grapes, blueberries, green tea, bitter cocoa, inhibit the signaling that leads to excessive VEGF production. They do not replace injection in severe cases, but they can reduce the need for frequent injections and, in early stages, prevent progression. The problem is that the person receives the diagnosis, panics, and starts drinking green tea with sugar, thinking he is doing something. Sugar generates insulin spike, which in turn stimulates VEGF. Then, the green tea with sugar is annulled. Once again, the mistake that cancels. The polyphenol needs to be consumed without the sugar spike, and preferably away from milk because the casein in milk can bind to polyphenols and reduce their absorption. Another patient, Mr. Roberto, a type 2 diabetic with incipient retinopathy. He was followed up with angiography every 6 months. When I adjusted his diet, removing vegetable oils, drastically reducing simple carbohydrates, and introducing a generous amount of dark green vegetables, frozen berries, and unsweetened cocoa powder, the next angiography showed reduced leakage. It wasn't the cure, but the progression stopped. He avoided injections for 2 years. The ophthalmologist was surprised and asked him what he was doing. Mr. Roberto replied, "I changed what I eat, doctor, and the eye obeyed." The eye obeyed, because the eye is not independent of the plate. Let's now go to one of the most insidious habits, the use of vasoconstrictor eye drops to whiten the eyes. That eye drop that promises to remove redness in minutes. The person wakes up with a red eye, uses the drop, and in seconds, the eye turns white. It sounds like magic. But what's going on? The eye drops contain an alpha-adrenergic agonist, which constricts the vessels of the conjunctiva. The eye turns white because the blood is expelled temporarily. However, with continuous use, the vessels develop tolerance. They need more and more frequent doses. When the effect wears off, they dilate even more, in a rebound effect. The eye becomes chronically red, and the person uses more eye drops. In addition, constant vasoconstriction reduces the flow of oxygen to the cornea and conjunctiva, which can cause long-term damage. This is the industry selling an immediate aesthetic effect at the expense of eye health. If you have a frequent red eye, don't cover the sun with a sieve. Red eye is a sign of inflammation, allergy, dry eye, blepharitis, something that needs to be treated at the root. It's not just ugliness, it's the body warning. Use warm compresses, clean your eyelids with diluted neutral shampoo, hydrate yourself, check your diet, but don't fall into the vasoconstrictor cycle. Now I'm going to enter a territory that stirs emotions. The fear of blindness is ancient. It is one of the deepest fears that human beings carry. And when vision begins to fail, the person often doesn't tell anyone. Hides. Find a way. He brings the book closer to his face, turns on a brighter light, gives up driving at night without admitting the reason. She does it out of shame, out of pride, out of fear of being seen as an old dependent. I attended a late Mrs. Irene, 81 years old. She came accompanied by her granddaughter. The granddaughter said that her grandmother was reclusive, that she no longer wanted to play cards with her friends, that she had stopped going to the club. Donna Irene, in a low voice, confessed that she was no longer seeing the cards properly. But it wasn't just the degree. It was the combination of dry eye, initial cataracts, and macular degeneration that no one had diagnosed. She thought it was game over. Literally. I sat next to her, held her hand, and explained that this was not the end. that cataracts could be operated on at the right time, that dry eye was treatable, and that macular degeneration could be stopped. She cried, not sadness, of relief, because someone finally explained it. Someone looked at her and saw beyond the medical record. That's the difference between treating an eye and treating a person. And that's what I want you to find. A professional who sees you in full. But in the meantime, you can start taking care of yourself today with what you put on your plate and how you organize your day. We have reached the moment of the great reveal, the climax of everything we have built so far. There is a hidden enemy that acts in the shadows, a cellular mechanism that connects all 7 signals I have described. It's a process that starts decades before and that most people don't even know exists. I'm talking about mitochondrial dysfunction. Mitochondria are the powerhouses of all cells. In the retina, the concentration of mitochondria is very high because the photoreceptors consume a brutal amount of energy to transform light into an electrical signal. Over the years, mitochondria become damaged. They mutate in their own DNA, separate from the DNA in the nucleus. They become less efficient at generating energy and start producing more free radicals. This mitochondrial decline is the backdrop to almost all degenerative eye diseases. What accelerates the decline? Excess sugar, lack of physical activity, coenzyme Q10 deficiency, magnesium deficiency, chronic exposure to unprotected blue light. And what protects mitochondria? Prolonged overnight fasting, regular aerobic exercise, exposure to moderate cold and specific nutrients such as coenzyme Q10, niacinamide, riboflavin, carnosine, alpha-lipoic acid, and resveratrol. Resveratrol, present in the skin of the purple grape and cocoa, activates a set of cell survival genes that tell the mitochondria to multiply and regenerate. It's as if you cleaned up the power plants. The problem is that most people take resveratrol in low-quality capsules with poor bioavailability and along with carbohydrates. The carbohydrate cancels out the effect of resveratrol because it activates opposite metabolic pathways. Once again, a mistake that cancels out. For resveratrol to work, it must be taken on an empty stomach, away from sugars, and preferably associated with a little bit of healthy fat, such as olive oil. And then, yes, the mitochondria of the retina begin to renew themselves. This revelation is the heaviest, because it means that eye degeneration is not an inevitable wear and tear. It's a cellular energy problem, and cellular energy can be modulated. It means you can literally rejuvenate your retinal mitochondria with the right strategies. This is not an empty promise. It's biochemistry. It's physiology. This is what cutting-edge science has been demonstrating. But no one tells you that in the routine appointment, because the routine consultation is done to prescribe glasses and eye drops, not to rejuvenate mitochondria. Only now you know. And knowing is the first step to acting. Now, my friends, I want to close with a direct message to you who are listening to me right now. You who are there, maybe alone, maybe accompanied, maybe with your cell phone in your hand, or maybe just listening while you do something else. I know it's scary. I know that the idea of losing our sight is one of the things that haunts us the most after a certain age, because vision is the sense that connects us to the outside world. It's what allows us to read the feelings in the eyes of the people we love. It is what gives us independence to come and go, to choose, to decide. And when that window starts to close, we feel like we're losing control over our own lives. But I want you to keep this. The body has an immense capacity to regenerate itself when we give it the right conditions. The retina can renew its pigments. The optic nerve can regain some of the conduction. The glands can once again produce quality tears. The brain can relearn how to process images faster. None of this is a miracle. It's physiology. But it requires action. It requires you to step out of the position of passive patient and take on the role of protagonist of your own health. It requires you to ask questions. It requires you to understand that the 15-minute consultation is just the beginning, and that most of the work of healing and protecting the body is done at home, in the kitchen, at bedtime, in the way you deal with stress. I'm not here to prescribe anything. This content is educational and is not a substitute for consultation with your doctor, but I'm here to give you what the system rarely gives: quality information, explained calmly, in depth, with respect. You are not a medical record number. You are a person with a history, with fears, with dreams, with people who depend on you, and with people on whom you depend. Taking care of your vision is an act of self-love, but it is also an act of love for those who are by your side, because those who love you want to continue to be recognized by you. He wants to continue to be seen by you, not as a figure, not as a shadow, but with the sharpness of affection. If this content touched you in any way, please share it. Not as someone who shares another video, but as someone who says to someone dear, look at this, it's important, it can make a difference. Send it to that friend of yours who is complaining about the view. Send it to your sister. Send it to your father. Send it to that aunt who bumps into the furniture in the hallway every night. Knowledge only has value when it reaches those who need it. And I hope, from the bottom of my heart, that you have found something here that makes sense for your life. Something that plants a seed of hope and action. Because as long as there is life, there is the possibility of regeneration. As long as there is retina, there are cells waiting for the right nutrients. As long as there is optic nerve, there are fibers that can be protected. And while there's you, there's a story that's still being told. Make the next chapters narrate with eyes that see, that shine, and that recognize the beauty of the world. A hug.